The nurse understands scope of nursing practice when making which of the following statements? A. The scope of nursing practice includes acts that permit some overlap between nursing and medicine. B. The scope of nursing practice includes activities that are legally permissible for a nurse to perform in a particular state. C. The scope of nursing practice are the specific duties the nurse owes to a patient. D. The scope of nursing practice involves those activities for which a nurse can be held liable for malpractice. Answer B. The scope of nursing practice includes activities that are legally permissible for a nurse to perform in a particular state. Rationale. Defining the scope of nursing practice is part of the responsibility of the State Board of Nursing. This involves determining the specific activities for each level of nursing and who can perform what functions. The duty that a nurse owes to a patient is part of the professional nurse-patient relationship. Any nursing activity that is outside the scope of nursing practice can be grounds for malpractice or negligence. A nurse is caring for a patient with end-stage lung disease. The patient wants to go home on oxygen and be comfortable. The family wants the patient to have a new surgical procedure. The nurse explains the risk and benefits of the surgery to the family and discusses the patient's wishes with the family. The nurse is acting as the patient's 1, educator 2, advocate 3, caregiver 4, case manager. Answer 2. Advocate. Rationale. An advocate protects the patient's human and legal right to make choices about his or her care. An advocate may also provide additional information to help the patient decide whether or not to accept a treatment or find an interpreter to help family members communicate their concerns. The examination for registered nurse licensure is exactly the same in every state in the United States. This examination, 1. Guarantees safe nursing care for all patients. 2. Ensures standard nursing care for all patients. 3. Ensures that honest and ethical care is provided. 4. Provides a minimal standard of knowledge for a registered nurse in practice. Answer 4. Provides a minimal standard of knowledge for a registered nurse in practice. Rationale. Registered nurse RR candidates must pass the NCLE-XRN at the individual state boards of nursing administer. Regardless of educational preparation, the examination for RN licensure is exactly the same in every state in the United States. This provides a standardized minimum knowledge base for nurses. A registered nurse RR is responsible for a caseload of patients during their stay in the hospital. Communication is lateral from RN to RN, and the RN has a degree of autonomy and authority. Which care delivery model is the nurse practicing within? A. Total patient care. B. Primary nursing. C. Team nursing. D. Case management. Answer B. Primary nursing. The factor that best advanced the practice of nursing in the 21st century was 1. Better education of nurses. 2. The growth of cities. 3. The teachings of Christianity. 4. Improved conditions of nurses. Answer 1. Better education of nurses. Rationale. Nursing is a combo of knowledge from the physical sciences, humanities, and social sciences along with clinical competencies. The nurse spends time with the patient and family reviewing a dressing change procedure for the patient's wound. The patient's spouse demonstrates how to change the dressing. The nurse is acting in which professional role? A. Educator. B. Advocate. C. Caregiver. D. Case manager. Answer A. Educator. What action might be taken on a nurse who commits an infraction of the Nurse Practice Act? A. The nurse is subject to discipline by a court of law. B. The nurse is subject to discipline by the State Board of Nursing. C. The nurse is subject to discipline by the local chapter of the State Nurses Association. D. The nurse is subject to discipline by the National League for Nursing. Answer B. The nurse is subject to discipline by the State Board of Nursing. Rationale: the Nurse Practice Act is regulated and enforced by the State Board of Nursing. State Nurse Practice Acts regulate nursing by controlling the scope of practice and determining the specific activities for each level of nursing. Some states control who may use the titles Registered Nurse (RN) and Licensed Practical Nurse (LPN) or Licensed Vocational Nurse (LVN). The Nurse Practice Act is regulated and enforced by the State Board of Nursing. The National League of Nursing is involved with nursing program accreditation. The local State Nurse Association does not provide discipline for infractions to the Nurse Practice Act. Only if the infraction is of a criminal nature will the State Board of Nursing refer the case to the local court of law. What is nursing process the foundation of? 1. Deals with issues of patient's concern. 2. Emphasizes research-based clinical practice. 3. Clinical decision-making. 4. Evaluates the patient's progress in learning. Answer 3. Clinical decision-making. Advanced practice registered nurses generally 1. Function independently. 2. Function as unit directors. 3. Work in acute care settings. 4. Work in the university setting. Answer 1. Function independently. Rational. Advanced practice registered nurse functions independently as a clinician, educator, case manager, consultant, and researcher within his or her area of practice to plan or improve the quality of nursing care for the patient and family. Healthcare reform will bring changes in the emphasis of care. Which of the following models is expected from healthcare reform? 1. Moving from an acute illness to a health promotion, illness prevention model. 2. Moving from illness prevention to a health promotion model. 3. Moving from an acute illness to a disease management model. 4. Moving from a chronic care to an illness prevention model. Answer 1. Moving from an acute illness to a health promotion, illness prevention model. Rationale: healthcare reform also affects how healthcare is delivered. There is greater emphasis on health promotion, disease prevention, and management of illness. Which of the following nursing roles may have prescriptive authority in their practice? Select all that apply. 1. Critical care nurse. 2. Nurse practitioner. 3. Certified clinical nurse specialist. 4. Charge nurse. 5. Nurse administrator. Answer 2. Nurse practitioner. 3. Certified clinical nurse specialist. Rationale: nurse practitioners and certified clinical nurse specialists encompass the role and preparation of the advanced practice registered nurse. According to the American Nurses Association, standards of practice prescriptive authority may be granted to these nurses. A critical care nurse is using a computerized decision support system to correctly position her ventilated patients to reduce pneumonia caused by accumulated respiratory secretions. This is an example of which quality and safety in the Education of Nurses QSEN competency. 1. Patient-centered care. 2. Safety. 3. Teamwork and collaboration. 4. Informatics. Answer 4. Informatics. Rational. Using decision support systems is one example of using and gaining competency in informatics. A nurse is caring for an older adult couple in a community-based assisted living facility. During the family assessment, he notes that the couple has many expired medications and multiple medications for their respective chronic illnesses. They note that they go to 2 different health care providers. The nurse begins to work with the couple to determine what they know about their medications and helps them decide on one care provider rather than two. This is an example of which quality and safety in the Education of Nurses QSEN competency. 1. Patient-centered care. 2. Safety. 3. Teamwork and collaboration. 4. Informatics. Answer. 2. Safety rationale, helping the patients understand the consequences and complications of multiple medications helps to build the competency in safety. You are participating in a clinical care coordination conference for a patient with terminal cancer. You talk with your colleagues about using the Nursing Code of Ethics for professional registered nurses to guide care decisions. A non-nursing colleague asks about this code. Which of the following statements best describes this code? 1. Improves self-health care. 2. Protects the patient's confidentiality. 3. Ensures identical care to all patients. 4. Defines the principles of right and wrong to provide patient care. Answer. 4. Defines the principles of right and wrong to provide patient care rationale when giving care. It is essential to provide a specified service according to standards of practice and to follow a code of ethics. The code of ethics is the philosophical ideals of right and wrong that define the principles you will use to provide care for your patients. The code serves as a guide for carrying out nursing responsibilities to provide quality nursing care and the ethical obligations of the profession. The nurses on a clinical unit voted to trial self-scheduling for 6 months. After the 6-month period, an evaluation will be completed with one component being to evaluate nurses' satisfaction with the process. Which component of decision-making are the nurses practicing? A. Authority. B. Responsibility. C. Accountability. D. Autonomy. Answer. D. Autonomy rationale. Autonomy is independent nursing interventions that the nurse initiates without medical orders. The nurse on an acute care medical floor noticed an increase in the number of patient falls. The unit introduces a new patient routing program. The nurse assigned to the project gathers data to monitor the effectiveness of the routing program over a 6-month period. The nurse is practicing in which nursing role? A. Nurse manager. B. Nurse administrator. C. Nurse educator. D. Nurse researcher. Answer. D. Nurse researcher rationale. The nurse researcher investigates problems to improve nursing care and to further define and expand the scope of nursing practice. He or she often works in an academic setting, hospital, or independent professional or community service agency. Nurses at a large medical center are participating in an education program led by staff educators to learn how to use an intravenous infusion pump to administer medication safely. This is which type of education? A. Continuing education. B. Graduate education. C. In-service education. D. Professional registered nurse education. Answer. C. In-service education rationale. In-service education programs are instruction or training provided by a healthcare agency or institution. An in-service program is held in the institution and is designed to increase the knowledge, skills, and competencies of nurses and other healthcare professionals employed by the institution. A nurse has relocated to another state and wants to find a full-time nursing job. What action should be taken first in order to provide care as a nurse? A. Begin applying for jobs at the local hospital. B. Contact the Board of Nursing in the nurse's new state to obtain licensure to practice. C. Begin practicing immediately, as the nurse is still licensed in the formerly lived-in state. D. Begin practice on a part-time basis so that a new license is not needed. Answer. B. Contact the Board of Nursing in the nurse's new state to obtain licensure to practice. Rationale. The nurse should contact the Board of Nursing in the state the nurse just moved to in order to determine what needs to be done to obtain licensure to practice in that state. The nurse should not begin practicing without an updated license, even on a part-time basis. Each state may require a new license, and the nurse will not be covered by a license issued in another state unless the state is part of the nurse licensure compact. Either way, the nurse will need to contact the Board of Nursing first. The nurse has an adequate understanding of Nurse Practice Acts when stating which of the following: A. Nurse Practice Acts do not help guide nurses. B. Nurse Practice Acts describe how to prepare for the NCLEX exam. C. Nurse Practice Acts describe how and when to renew a nursing license. D. Nurse Practice Acts provide a list of job openings. Answer. Circa. Nurse Practice Acts describe how and when to renew a nursing license. Rationale. Nurse Practice Acts are great resources that provide information to nurses, including how and when to renew a nursing license. The Nurse Practice Acts do not describe how to prepare for the NCLEX exam or provide a list of job openings. Which of the following internet resources can help consumers compare quality care measures? Select all that apply. 1. WebMD. 2. Hospital Compare. 3. Magnet Recognition Program. 4. Hospital Consumer Assessment of Healthcare. 5. The American Hospital Association's webpage. Answer 2. Hospital Compare. 4. Hospital Consumer Assessment of Healthcare.